there. Let's stay with the issue of International Nurses Day. We can speak now to Professor Hester Klopper, who is the Deputy Vice-Chancellor of Strategy at Stellenbosch University. Prof, a very good afternoon to you. Welcome to Daytime Update. Not sure how much of that conversation between the nurses and our reporter, Zikwana Chona, you were able to hear, but Sister Lizzie mentioned that she left the country for 5 years because she had started to take financial strain. How much is the issue of income contributing to the loss of critical skills in the nursing profession in South Africa?
Well, good afternoon to Mikile. Indeed, it is a challenge. I think if we look at some of the reports that we've been seeing coming from the Department of Health, and specifically from our Minister, Joe Pasla, one would have noted there's around 10,000 vacancies at the moment. So I think it's if we look at in terms of a systems perspective, there's two issues. First and foremost is that we have qualified nurses within the country that are not being appointed on a full-time basis. And secondly, if we then look at the income levels of some of the nursing categories, it's indeed become a challenge for nurses to survive.
You mentioned the 10,000 vacant nursing positions in the country. By December last year, in a parliamentary reply, the minister said that only about 3,000 odd nurses had graduated with degrees, and there's this growing call that what South Africa needs most, in fact, are nurses with a degree qualification, and so we say somewhat of a specialized skill, for want of a better phrase. So how do we match the two?
Well, most probably we need to differentiate between the different categories of nursing. So if we look at the South African Nursing Council register of 2020, we will see that there's around about 270,000 registered or nurses on the register. But that doesn't mean that all of them are professional nurses with a 4-year diploma or a degree qualification. And that is the category that we are really in need of. And why is it important that we look at degree nurses? Is first and foremost, there's been international studies around the globe that has indicated that the better qualified nurses are, and specifically with graduates entry into practice, that the better the patient outcomes is. And just to put this into perspective, most probably, if we look in South African context, there's around 1.1 nurses for every 1,000 of our population. If we compare this then to some global statistics, for example, in the United States, we're looking at least 12 nurses per 1,000 of the population. So I think that puts it into perspective. If we compare degree nurses in South Africa, it's still less than 25% of those that enter the employment markets. And of course, that lends itself to a huge gap. Most probably, I can also share that in the latest report from HASA and the Department of Health, as recent as 2021, it clearly indicates that the gap, especially within the degree nurses, is growing, and that by 2030, we will most probably looking at a gap of 62,000 degree qualified nurses. So, I mean, this is really becoming serious in terms of making sure that there is equitable healthcare to the total population.
So it's interesting, isn't it, that there are these vacant positions for nurses. You've got, as you're saying, a prediction that it's likely to get worse, but you've also got a health department that's working on a budget that is constantly being cut 1 year to the next. And that raises the question of making nursing an attractive prospect for people in the medical field when you consider that many of them could go elsewhere to look for work. I mean, if in the US, for example, nurses are quitting to go into other industries, that could then open up positions for our nurses to go work there for money that's slightly more, no?
Absolutely. And most probably this is where I can share some ideas around the specialization that you referred to as well earlier. So what we would see in a country like the UK, United States, Canada, is that there's an absolute growth in terms of the specialized nursing category. So these are nurses that at least have a master's degree and that can function as an advanced practice nurse. In South Africa, if we look at our statistics, there's around 35,000 of the nurses on the register with an advanced qualification, which means that they can provide primary health care, and in actual fact, quite a number of them can even prescribe the essential drug list. I think what is needed in our country is that the advanced practice nurse qualifications needs to increase. And the reason for that is that we don't need to wait for the Department of Health to absorb all of these nurses into a healthcare system. But it provides, as we've seen in other parts of the world, for nurses to open their own practices because they are then recognized as a specialist within their clinical area. There's some areas in nursing in South Africa that we have seen it, and most probably specifically within midwifery, where we see advanced nurse midwives opening their own practices and assist with home care delivery. We've also seen in mental health, psychiatric nurse specialists, but I think there's a huge opportunity for nurses to be entrepreneurs and not only wait for government to fill those positions.
To what extent is it still true, Prof, that nurses in public hospitals are more despondent than their colleagues in private healthcare?
My personal understanding of what we've seen with some of our research is that gap has closed somewhat in terms that government has increased the salary levels of nurses within the public sector. I think that the largest challenge in terms of the difference of these two systems is most probably the lack of resources within the public sector. And here I refer to equipment, and I mean, this we've seen during the COVID period. If we've just recently, within the next month, we will be publishing a book where we've listened to nurses' stories and their experiences of what they've seen during the COVID period and the trauma that they've been through. And mainly within our private or the public healthcare sector was almost an absence of some of the equipment. But equally so, I mean, there was challenges in oxygen supply, ventilators, also in the private sector. So huge challenges in terms of adequate provision of resources. But that also speaks to human resources and making sure that there's adequate workforce. I think what I also would like, being at a university, to highlight is the fact that there's also a huge challenge awaiting us to get nurses into academic positions at universities. If we, for example, look at the positions at universities, it's close to 50% of staff within nursing divisions or departments or nursing schools at universities are part-time employment and not being offered full-time employment. And the challenge is not on the university side itself, but it's also the joint appointments on clinical platforms to provide facilitation for our clinical students in the clinical areas. So it is indeed also, I think, extended into closer collaboration between the Department of Health, Department of Higher Education and Training, and of course then with the fiscus, to make sure that we would be able to unlock somewhat funding to address this huge challenge at different levels within the system.
Professor Hester Klopper, the Deputy Vice-Chancellor of Strategy at Stellenbosch University. Good to have your time today, ma'am. Thank you.